following ch 466. 1 MD/surgeons. 2 qualified anesthetist. 3 dentist in the armed forces. 4 out-of-state/country licensed dentists at MTGS of dental organizations. 5 dental/DH students. 6 dental, DDS/DMD, instructors. Direct supervision a dentist. 1 examines the PT. 2 DX a condition to be TX. 3 authorizes the procedure. 4 remains on premises while performed. 5 approves the work before dismissing PT. Indirect supervision a dentist. 1 examines the PT. 2 DX a condition to be TX. 3 authorizes the procedure. 4 on premises while it's performed. General supervision a dentist. 1 examines the PT. 2 DX a condition to be TX. 3 authorizes the procedure. Does not have to be present while it's performed, nor does it have to be performed at the dentist's office. Irremediable tasks intraoral TX that is irreversible and creates unalterable changes W/in the oral cavity or cause an ink risk to the PT. X. Administering anesthesia, except topical. Remediable tasks intraoral TX that are reversible and don't create irreversible changes in the mouth do not cause an ink risk to the PT. The Board of Dentistry consists of how many members and what type? 11 members total, appointed by government. 7 dentists, practicing at least 5 YRS. 2 DHS. 2 laypersons who have nothing to do with dentistry. Asterisk at least one member must be 60 yo. How long is a term when serving on the B of D? 4 YRS. What is the max hashtag of YRS you can serve on the B of D? 10 YRS. How long is an expert witness certificate good for? What can you do with it? 2 YRS. A. Provide written medical expert opinion. B. Provide expert testimony on present STD of care. Does not authorize you to practice dentistry. What constitutes full-time practice? 1,200 HRS per year. What is a health access dental license? A license granted to an out-of-state dentist in order to practice in underserved health access settings. How many HRS of CE credits are dentists responsible for? 30 HRS every biennium, in dental subjects. How many HRS of CE credits are DH responsible for? Min 24 hours, max 36 hours every biennium. Where do you keep a license in your dental office? Conspicuously displayed in plain sight of the practitioner's patients. Can a DH give local anesthesia? Yes, if under direct supervision. Non-sedated PT. PT is greater than 18 yo. Certified, 30 HRS didactic training, 30 HRS clinical. What is a dentist of record? Primarily responsible for all dental TX on that PT. IDED in the PT record. If not IDED in the PT record, presumed to be the owner, dentist. If greater than one dentist, it's the one who places the final restoration, etc. What is a new dentist of record required to do? Take /RVW Med HX and dental records. Examine the PT. Develop a new TX plan or continue the old one. How long do you have to maintain a PT's records? 4 YRS from the date of the PT's last appointment. RVW advertising by dentists, no false/fraudulent/misleading/deceptive statements or claims. No laudatory statements about yourself. Cannot create false expectations. Cannot appeal to fears. Cannot contain fee info without a disclaimer that it's a MIN fee only. Etc. What does a Labrx need to include? Dated and signed by dentist with license hashtag. PT's name /hashtag. Specification of materials. Copy kept by dentist for 4 YRS, original kept by lab for 4 YRS, if not, second-degree misdemeanor. Scope and area of practice of DH, removing calculus, accretions, stains from exposed surfaces of teeth and gingival sulcus. Root planing and curettage. X. Rays. Apply topical preventive/prophy agents. What can a DH do without any supervision? Provide educational programs, faculty/staff training programs. Rinse programs. Apply topical FN sealants. Provide OHI for a PT/supervise O of a PT. Dental charting. Record BP, PRRR, temp, and case HX. Remove calculus/stains, but need med clearance. Must not involve DX or TX of dental conditions. T/F medical clearance by a physician or dentist is required before a perio probe may be used on a person who receives a dental charting. True. A DH cannot perform another prophy after __ months has elapsed if the PT has not had a clinical exam with a dentist. 13 months. Examples of third-degree felony: practicing without a license, suspended/revoked. Giving false info/evidence to the board, etc. Examples of first-degree misdemeanors: using DMD/DDS if you don't have a license, same for RDH. Presenting someone else's license as your own, etc. Dental lab excludes any dental lab tech who works in the office of a licensed dentist for that dentist only and under their supervision. What does dental lab registration entail? How many CE credits are required? Applying for a registration certificate every 2 YRS, if you don't register second-degree misdemeanor. 18 HRS of CES every biennium, owner or an employee. Are dental labs allowed to advertise? No, not to the general public. If you advertise a certain fee, what are required to do? It has to have a disclaimer that it is a minimum fee only, state a specified period during which it's effective, or after the final ad airs the fee remains for 90 days. You must describe the service being offered. How can a DA get certified to take X rays? Apply for certification. 3 Mo's on the job training under direct supervision. Complete a board approved course. When can you reactivate an inactive license? At any time. Pay reactivation fee. Must keep up with CES. If inactive for 2 consecutive biennial cycles / not practice for 2 of 4 previous YRS in another jurisdiction, must appear before the board to EST ability to practice. How do you reactivate a retired status license? At any time. Pay the reactivation fee. Keep up with CES. If retired 5 YRS appear before Credentials Committee. What CE courses are required and when for licensed dentists? 2 HRS on DV every 3rd biennial, 6 YRS. CPR every 2 YRS. HIV/AIDS course by first renewal. 2 HRS on prevention of medical errors. What CE courses are required for licensed DH? 2 HRS on DV every 3rd biennial, 6 YRS. CPR. HIV/AIDS course. If you participate in exam standardization exercises, how many CE credits can you get? 6 per biennium for DH exercises, both D and DHS. 8 per biennium for dental clinical exercise, for dentists. 11 max for doing both as a dentist. If you participate in substantial pro bono service to the indigent/underserved POPs, how many CE credits can you get? 7 CES per biennium. AMT calculated by board based on time worked. If you serve as an expert witness, how many CE credits can you get? Max 11 CEHRS for completing 5 disciplinary cases each biennium. Max 4 CEHRS for completing 2 disciplinary cases. Max 11 per biennium. If you serving as adjunct, part-time faculty, at AD/DH school, how many CE credits can you get? 3 CES per semester/quarter. How many CES can you get for attending a meeting of the Board of Dentistry where disciplinary cases are considered? Up to 4 CES per biennium. If you participate as an anesthesia inspection consultant, how many CE credits can you get? 2 CES per biennium. How long do you have to keep records of completing your CES? 4 years. Who is not responsible for CE credits? If you're enrolled FT in post, grad specialty training/residency program. FT faculty member at D/DH/DA school. If you are an approved provider of CE courses, how many max HRS can you teach? No more than 12 HRS, unless it's CPR to staff/employees, every biennium. You can get self-study CES via, first time you present material at a professional conference/MTG, 2 CES per 50-minute segment of presentation. Publishing an article/book, AMT determined by board. Presenting a lecture, at D/DH/DA school, 2 CESP 50-minute lecture. Max 15 CEHRS per biennium. Who is on the probable cause panel? How long do they serve? 3 members, 2 must be active dentists. 1-year terms. What kind of violations can be taken care of W/just a citation? What is the penalty for a violation? Those that don't pose a substantial threat to the public health, safety, and welfare. First offense equals $250 fine. Second offense equals $1,000 fine. 04 CEHRS in ethics. How long do you have to give a PT their records? 30 days from written authorization. GA-controlled unconsciousness. Partial/complete loss of protective reflexes, inability to maintain airway. DP sedation-controlled depressed consciousness. Partial loss of protective reflexes, can't maintain airway. CS depressed level of consciousness. PT retains ability to maintain airway on their own. Margin of safety wide enough so that PT doesn't lose consciousness unintentionally. Pediatric CS depressed LOC. Retains ability to maintain airway. Margin of safety. Child equals 18 yo or person W/special needs. N20/O2 inhalation analgesia altered level of consciousness. PT retains ability to maintain airway. LA loss of sensation of pain in a specific area of the body. No loss of consciousness. Analgesia absence of sensing pain. No LOC. Minimal sedation, anxiolysis. Perioperative use of meds to relieve anxiety. No depressed level of consciousness. 1 enteral sedative or 1 narcotic analgesic. Permit not REQ. What drugs can be used with a GA permit? Propofol. Methohexital. Thiopental. Etomidate. Ketamine. Who is eligible to get a GA permit? Completed MIN 1-year residency in dental anesthesiology or OMFS residency. Diplomate of the AMER Board of OMFS. Eligible for exam by the ABOMFS. Member of the AMER Association of OMFS. How many PPL must be present when admin GA? 3 PPL, operating dentist, person to monitor the PT, and assistant to the dentist. CS certification REQ. What type of formal training/certification? Same for pedo CS, Min 60 HRS didactic HRS, 4 HRS airway MGT. Clinical training that includes you personally admin for 20 PTS, 3 HRS dedicated to hands, on airway MGT. Pedo CS permit holders have to have graduated from a post-doc pedo residency. How many PPL have to be around to admin CS/pedo CS? 2 PPL, dentist and auxiliary trained in basic CPR. N20/O2 permit requirements, 2-day course/training. CPR. ACLS/PALS. If a RDH has a permit to admin LA, what are the stipulations? PT must be 18 yo. Under direct supervision. PT must not be sedated. If you hold an active sedation permit, what CES must you take? 4 HRS in airway MGT, 2 HRS didactic in compromised airways, 2 HRS hands-on. 4 HRS in medical emergencies. Every 4 YRS from the last time you took the course. What is an adverse occurrence? Any mortality as a result of a dental procedure or an incident that results in the temp or perm physical or mental injury that req hospitalization or ERTX that occurred as a result of any type of sedation. How long do you have to report an adverse occurrence? 48 HRS by registered mail to the board. 30 days for complete written report. DH under direction supervision can perform, gingival curettage. DH under indirect supervision can perform, root planing. Removal of excess cement/bond AW/slow SPD. DH under general supervision can, remove calculus deposits, accretions, stains from exposed surfaces of teeth and in gingival sulcus, prophy. Take X, rays. DH can perform these W/no supervision, educational programs. F rinse programs. Apply F varnish. Give OHI. As long as DX/TX doesn't happen. If there's an emergency and the dentist isn't there, but will be W/in 3D, DH/DOS can do the following: 1. Remove/re, cement loose bands. 2. Secure an arch wire. 3. Insert/remove dressings from alveolar sockets. 4. Place/remove perio dressings. 5. Cement temp crowns. 6. Place temp medicinal restorative material. If a licensee changes their address, when do they have to notify the board? W/in 10D in writing. What must a PT's written record contain at minimum? Med-HX. Results of clinical exam/tests conducted, oral path. X, rays. TX plan proposed. TX plan rendered. Split, fee arrangements ____, when referring clients to another healthcare practice, is prohibited. What type of emergency care are dentists responsible for? To provide either personally, through another dentist, or through an agreement with another agency, reasonable 24HR emerge services for all puts under their continuing care. What is the MIN malpractice insurance a dentist must possess? $100,000 per claim with a minute, annual aggregate of $300,000. Must cover liability of any DH supervised by the dentist. What's up with Sargenti material? Was used as an endo-filling material/cement. Contains paraformaldehyde, which can cause severe and irreversible damage to PTS. Does not meet MINSTDs of performance. Do not use it. Removal of amalgam fillings for the purpose of curing/preventing systemic illness __. If you do it, you must inform your PT of, constitutes alternative/complementary healthcare. Benefits/risks of TX, dentist's education about it, make a note of how these regs were met. What piece of equip is every dental office REQ to have? AED, automatic external defibrillator. What are the 5 acceptable methods a dental office can use to sterilize instruments? 1. Steam under pressure, autoclave. 2. Dry heat. 3. Chemical vapor. 4. Ethylene oxide. 5. Disinfectant/sterilant. How long must a heat-sensitive instrument sit in a liquid chemical agent in order to sterilize/disinfect it? Up to 10 HRS. How often do autoclaves and chemical vapor sterilization need to be verified? Every 40 HRS, 2400 minute, or 30D, whichever comes first. How often do you have to check the efficacy of dry heat and ethylene sterilization? Every 120 HRS or 30D, whichever comes first. Can you practice with Hep B? Yes. There are just lots of rules to follow. Notify the board in writing W/in 14D. Take 6 HRS of class with a written exam. Office is randomly monitored 1x/year. Must notify the board if barrier technique is broken W/in 24HR, notify PT IMD. Are extracted teeth biohazardous? Yes. But they can be disinfected and no longer considered thus by, first scrub with detergent and water or put in ultrasonic, then store teeth in bleach with water. 110. How do you discard extracted teeth and tissue fragments? As biohazards waste or as a sharp? How must contaminated items be shipped to a lab? Sealed in an impervious container and labeled TX as infectious material.